Ever wondered why patients might be leaving your dental practice? Is it because you are not wowing them? Probably not. Are you ready to learn why people are leaving and how you can keep more of them? Hey everyone, I'm Ryan Smith DDS, and today I want to help you keep more of your patients. In my numerous conversations with dentists about patient retention, I have often talked about patient attrition. Many respond with a casual response, "Oh, I'm not really losing many patients. I see maybe one records request every other week." But we are getting more new patients, so it kind of works out. They tend to use this as a benchmark, assuming they're only losing a handful of patients each month, perhaps 3 or 4. But let's pause and consider the bigger picture here. For every records request you receive, it's likely there are 10 to 15 more patients who are quietly slipping away. They may feel too intimidated or uncomfortable to ask for the records and instead choose to silently start fresh at another practice. This is a big indicator. If you're noticing this level of record requests, it's a red flag that is worth a deeper dive into your practice's operations and patient communication. Now let's talk about the common advice you might hear from consultants and educators in the dental field. The idea that the key to patient retention is to wow them.
Wow.
While it's definitely helpful to create positive experiences, I think that for most dentists, this is really bad advice and a distraction. It's essential to understand that when a patient walks into your clinic, they come with a set of basic expectations. They already believe that as a dentist, you're competent and that you're there to assist them and that you're capable of delivering quality care. The real task for every dentist then isn't initially about going above and beyond to impress. It's fundamentally about not giving your patients any reason to leave in the first place. Mastering this approach is crucial. Once you've established this trust of foundation and reliability, then by all means, aim to wow them. This extra effort can enhance patient loyalty, but only if your practice has mastered the basics. No amount of wow factor will overshadow the problems created when a patient has to pay twice as much as they were expecting, or messing up on their billing in general. So before getting into elaborate strategies or impressive technological advancements, focus your attention on excelling in 3 critical areas that form the bedrock of patient satisfaction. Respect their time, their money, and their comfort. These are not just operational tasks, they are the cornerstone of building a successful practice. By prioritizing these aspects, you will have the foundation in place where you can be confident that when a new patient comes into your door, they will stay. Only then should you explore additional ways to elevate the patient experience and truly wow them. Let's start with their time. I do not understand why most dentists habitually accept the fact that patients are being seated late. Of course, it is understandable if it happens once a day or every 2 days, or it's related to some unforeseeable event, but most dentists I know are completely comfortable with seating patients late as a whole. You will forever hurt your practice if you accept this mentality. Now, you might be thinking, well, I don't accept it, I just don't know what to do. Well, efficient scheduling. Start out by making sure you are appropriately scheduling. You need to schedule efficiently and accurately. I do not mean to change the times of your appointments so that you never ever run behind. If you are scheduled appropriately, then 95% of the time you will stay on time. Then for the 5% of the time that something happens and you can't stay on time, if your team knows that you do not accept seating patients late, then they can work together and someone who is more available can help seat that person when something comes up. If you do not allow staff to have the expectation that seating patients late is okay, then they can work together as a team to make it happen. There are, of course, some situations where it may be okay to not see them on time. Let's use, for example, emergency appointments or same-day treatment where we are working the patient in. In these situations, it is okay to not see them on time, but you have to make sure to set and manage appropriate expectations. If someone is expecting to be seated at 9 a.m. and you see them at 9:15, they are going to be mad. If you have an emergency patient that you are working in and you tell them it may take 20 or 30 minutes to be seated, but we will do our best to work them into the schedule, then if we see them at 9:15, they're going to be happy because we worked hard to get them in and it was better than they expected. Managing expectations is critical. The next critical item is don't mess with their money. At this point as a dentist, you should realize patients have no understanding of what is expensive or cheap when it comes to dental work. Dental finances are ridiculously confusing and we all have insurances to thank for that. We don't need all those codes. We don't need the complexity, but that is where things are at and I don't want to go down that rabbit hole during this video. Let's talk about some ways that you could help patients realize they're getting a good value and help help them in a way that doesn't financially stress them out. Make sure you have clear financial policies reviewed with your patients. Unfortunately, most patients sign this in the very beginning and never look at it again. Anytime you do a financial arrangement, make sure that you review the basics of your financial policies to help set the expectations appropriately for your patients. If you are in network with insurance, you need to let them know that they are getting a significant discount by being in network with the insurance. Most patients have no idea they are getting a cheaper deal because you have a discounted PPO rate. Also, make sure to point out that insurances are not clear with their billing processes and fees. We are doing our best educated guess to approximate what the insurance will cover, and we are doing this so that they don't have to mess with it on their end. So please expect potentially a 10 or 15% difference when the insurance comes back and pays. Now, obviously, we hope this is not the case, but again, you are managing expectations and setting things up for success. If you are doing a financial arrangement for procedures that you think are at risk for being called cosmetic, then make sure you clearly document and tell the patient that. And at least plant the seed that the insurance may not cover this, but we will do everything we can to help you get it covered. These discussions are very important because billing errors and paying more than they were expecting is a very common reason for patients to leave a practice and write a bad review. As a dental office, you also need to have flexible payment options. Most dental treatments are expensive and typically more than the patient is ready to pay for at that moment. You need to play the role of problem solver to help them find a way to afford their dental care. If you are completely rigid and unhelpful, this will be received very poorly by patients and is a very common reason that people will leave a practice. Anytime you send a patient a statement or try to collect more money than what the patient was expecting to pay, you need a very clear explanation and communication with the patient. Don't just send an EOB and then a bill. Make sure to always say something like, the insurance covered less than we expected, or the insurance is being difficult and not covering things as expected. Don't make them read an EOB or investigate to figure out why they have a balance. The more you make them do that, the more angry they'll be, and the more phone calls you'll have to answer, the more patients you'll have to calm down. Now, the third item is pretty straightforward. If you make the dental visit uncomfortable or painful, then there is a good chance that patient does not come back again. The dentist is already a very stressful place for most people, and if you don't operate in a way that is comfortable, empathetic, and kind, then you are creating a patient retention nightmare. Just don't hurt them. As you refine your skills for each procedure that you do in your practice, make sure that you have the patient's comfort in mind. You should always be looking for ways to not only improve quality and efficiency, but also looking for ways to create a better patient experience. Remember, perception is reality. I could go on for hours with examples of dentists that were not clinically good, but in the eyes of their patients, they were amazing. I could also go on even more about dentists who were clinically amazing, but because of their poor communication skills, their practices suffered and patients had a very poor perception of them. Always remember that for your patients, perception is reality. And make sure to have some empathy and look at things through the eyes of your patients. When you start a procedure, you should always let the patient know that if at any point they're uncomfortable or need a break or an extra rinse, they can raise their hand and you'll stop. This helps calm them down and realize they have some control in the process. During a procedure, you should stop every so often and just check to make sure the patient is doing okay. Most dentists have a lot more fun looking for the shiny new thing or looking for the easy fix or the quick fix. They never want to focus on improving the small and simple things about a dental practice. So hopefully this video has you looking a little more closely at your day-to-day operations around time, money, and pain. Let's work together to make dentistry more fun, rewarding, and fulfilling. If you have questions, ideas, or topics you'd like me to cover, comment below or send me a message. I'd love to hear from you. Don't forget to subscribe and stay tuned for more.